Senator Benson, I get, having a chance to think over and look over your amendment and your original amendment having to do with cost sharing. Overall, I think it is comes a long way towards trying to address issues that what I've really been focused on this session. What I've been focused on is finding a way to help prevent patients who are really faced with the highest costs, those who are uninsured and underinsured for their insulin, which they need for daily living. I mean, it's a life, it gives them life. And so I would say that this insulin assistance program, while I think it has a couple deficiencies that I would prefer my bill, the 90-day window of time, I would prefer that. And also that my bill would have addressed patients who have high deductible health plans. Patients who have a high deductible health plan and have a deductible could be well over $5,000 are really faced with a lot of extreme costs in the initial months of the year, and they could be affected by not being able to access a program like this emergency program. Now, I understand your other amendment that has to do with cost sharing that should address their cost for insulin, and maybe that takes care of it. But I would just say that appears to be a concern. I would just want to make sure that we think that all the way through, are we taking care of all of the different patient situations? And with this, with the cost sharing, as Senator Rosen mentioned, the emergency refill, prescription refill language, and then the other language that was inserted in Senator Rosen's bill, which directs the Board of Pharmacy to create materials and a website that help patients find access to all of the different program options. That could include public programs if they qualify for medical assistance, Minnesota Care. It could also direct them to patient assistance programs. I have heard mixed messages about how accessible those patient assistance programs are. Some people, some advocates have said that they put too many barriers in the way of the patients to be a really helpful program. I've also heard from manufacturers that they are trying to improve those programs and make them a one-call assistance for them to get access to insulin supplies if they can't afford it. So it sounds to me like all of these things together will help patients out, and type 1 diabetics are dependent on having access to insulin. It's better for our society if they have access regularly, rather than impacting their health by rationing or somehow not being able to use the insulin as their doctors direct. So this language, all of the different provisions go a long way to addressing those concerns. And I appreciate your working with me on the cost sharing amendment as well. Thank you. Thank you, Mr. President. Just to add to Senator Marty's comments, I do also want to indicate that the language I had planned to offer as an amendment tonight, the Alex Smith Act, is included in the House omnibus bill, and I would see it as a positive thing if we have this language in the Senate bill in order to have a better conversation in conference committee, and maybe we can have more thorough discussion about how the fees are assessed and also who is covered by the program. Thank you.